Hello everyone. I am going to give 5 X-ray chest spotters. You see the image, then think about your diagnosis. If you cannot think about the diagnosis, at least you can think about the differential diagnosis, right? I'm going to give 5 images now. First image, so you can see the image. So overexposure is there, but still you can detect it. Now you can see the arrow. It's very easy now, right? What's the diagnosis? So the diagnosis is it's a stent in the aortic knuckle. Almost means the diagnosis is that's a stent done for the coarctation of aorta. So that's the image. You can see it very well. I have magnified it and you can see the arrows. So that's the stent. So it can be easily missed. For example, the neurologist advises some MRI brain and the patient doesn't say that history to the neurologist or to the technician, MRI technician. It will be a disaster. We'll go to the second case. I think slightly underexposure, but still you can see it very well. What's the diagnosis? Yeah, I'm giving the arrow. Now you know the diagnosis. This is a very common, it's very common in the exam, especially not only radiologists, but also for other specialties. And that can be mistaken for something else. So that's very important, especially in a case of tuberculosis or a tumor. So this will be important. So you have to know about this. This is a variant of azygous vein. So this is called as azygous fissure. The azygous vein will be almost in the right paravertebral region. Yeah, we'll go to the third case. So this is a clear-cut spotter. I think it's very simple. So it's pneumoperitoneum beneath both diaphragms. It's very common. Usually we'll have on right side. So here you can see on both sides bilateral pneumoperitoneum. It indicates it's more air in the peritoneum. So you can see the funding bubble too, right? Okay, we'll go to the fourth case. Infiltrates or something in the right lower zone, just ignore that. So very important one, a spotter, very common spotter. So that's the, yes, you can see the arrows. That's a right-sided aortic arch. We'll go to the fifth case. Very common exam spotter. It's a very common spotter. So you know the diagnosis? Yes. So that's the shadow, something I have given arrows. You see the right breast shadow, whereas it's not there, and you can see the left lung looks slightly blacker than the right one. So it's because due to the left mastectomy. So that's why you have that pattern. The patient underwent radical mastectomy due to CA breast, and X-ray chest was done to rule out metastasis, and it was a spotter. So it was, otherwise it was normal. Remember that whoever has given all the answers correct, so congratulations to them and take care. Bye bye.